birth, death, infinity.
Good afternoon, and welcome to Your Health radio and television program on the radio at AM 1240 KNRY, AMP's cable television channel 24, and on the web at www.ampmedia.org. Join our rotating host and their informative guests live every Monday afternoon at 4 o'clock. The purpose of the Your Health radio and television program is to help get, make, and keep listeners and viewers like you healthy. And now, ladies and gentlemen, on with the program.
A little bit about my concept and my bias about physical therapy. I think of the physical therapist as being so helpful to a patient after an operation, like a hip replacement or after an injury. And I also think about physical therapists can be very helpful after some certain disease processes or an injury like a stroke. But it seems like physical therapy is such a broad field. Now, what do you like to do as a physical therapist?
Well, it is a broad field, and I think that there's going to be an expansion as we find more and more research showing things that the physical therapists can do and can be helpful with. We do a lot of the post-surgical things that you're talking of, and that's always been kind of a staple of the physical therapy business and industry, is to try to help people post-stroke or post-surgical. There's also a lot that can be done pre-surgically, which we try to educate a lot of the patients about, educate doctors about. There's things that maybe you would like to do before they have a surgery to get them stronger, more able to tolerate the surgery better, or just have a better idea of what to think is going to happen during the surgery. Education is a huge portion of what we do.
Well, Mark, let me ask you a little bit about that. So say someone is scheduled for a total hip replacement. You know, I'm accustomed to seeing these patients see their orthopedic surgeon. They'll have a hip replacement. They'll recover probably one night in the hospital. And then usually the next day or 2 days later they get into intensive physical therapy. But you just mentioned that sometimes physical therapy can be helpful before an operation. Is that right?
Absolutely. We'd actually prefer to have a patient come in a few days before the surgery, have 1 or 2 sessions. A lot of it is to try to get them to understand what we're going to be doing after the surgery's done. But we can also give them an idea of, once the surgery's done, this is how they're going to ask you to get in or out of a hospital bed so you don't dislocate the hip again. Or this is how you want to move around in bed, or these are the muscles you need to be aware of. And it's a lot easier before they've had the anesthesia and before they've had the shock of the surgery and such for them to retain the knowledge. So we'd much prefer to do that.
Well, Mark, why is it that physical therapy is such a key component of the post-operative care? And now you're suggesting it can be valuable before an operation. But why, for example, is it so important for a person, say after a shoulder operation or after a hip replacement, to get physical therapy? Why is that so common? In fact, it's getting to be part of the healing process, isn't it?
It really is. There's a lot of little bits and pieces that obviously when the surgeon is done, you have a joint that is in much better condition to be able to rehab. Surgery isn't done unless something has gone wrong to the point it's not going to heal itself. The therapist comes in and then teaches the patient a lot of times what education as far as this is what to expect, but also a lot of these are the exercises you want to do, and when you're doing this stretch, you need to be really careful because pain in this particular part of the shoulder or hip is something you want to avoid. If you feel the muscles working on that part of the hip, that's what you want to feel. So there's a lot of that education as this is normal. Yeah, that amount of pain is normally what you're going to get. Or no, that's an unusual pain, we need to talk to your doctor, or maybe you need another set of x-rays. So it's a coaching portion. Part of it's just to try to give them an idea, some education. And then a lot of it is also in the clinic we have equipment that a patient would not normally have at home.
Well, Mark, a lot of my audience, or many people in the audience, whether they're listening or viewing, they know I'm a plastic surgeon, and they know I do a lot of hand and wrist surgery. And what we're always trying to combat after an operation in the hand and wrist is the formation of scar tissue. So any operation involves making an incision, even if it's very small incisions, and we try to slip in and out and minimize the scar. But certainly we find occupational therapy and physical therapy very helpful to minimize scar formation and minimize those tough scars that can occur inside a joint or inside a body part. Isn't that true?
Absolutely, and it's amazing. I've been a physical therapist now for 25 years, and to see the progression of how much better the surgeries are nowadays with the equipment and the techniques, it's just mind-boggling how surgery has changed and how quickly patients are able to do something that they may not have been able to do. You know, if you look at a total knee surgery 25 years ago, you look how much quicker a person is up and around now because of the advanced surgical technique. With the hand, I mean, that's, and obviously you know this, but for people that don't, that's probably the most delicate surgery that could possibly be done. And plastic surgeons are the guys that you want doing that, because the type of surgery is very different than, say, an orthopedic surgery would be. So we'd always like to see the hand surgeries come in from a plastic surgeon.
Well, I certainly appreciate hearing you say that, Mark.
But, you know, as you were talking about the scar tissue formation, there's things that we've done for, you know, years and years now to decrease the scar tissue. And if you think of a cut that's happened on your arm or your hand, you know, people think of that scab that they see on the outside as being the only scar tissue formed, but the scar tissue that's formed inside is the same as the scar tissue that's formed outside, and it needs to be dealt with. You know, nowadays we have the lasers, we have cold lasers that we use, different types of electrical stimulation that we didn't have, much more tunable ultrasounds. You know, a lot of the equipment that we didn't have before that we do now that can really help the scar tissue to go away much quicker. And then the research has been better. We know what types of exercises are actually going to be more effective than we did 25 years ago. What sort of things, you know, what kind of a load can we put on the hand? How hard can they grip, and how hard do they need to be careful of, and such. So the research that's been done has helped us tremendously.
Mark, that's great. Now, you know, I do want to ask you about other areas besides post-surgery and pre-surgery physical therapy. I do want to talk about that. But before we get into that, tell me a little bit about how you got interested in going into the physical therapy field.
Well, the very first time I really became aware of therapy, my father had had his knee, pretty severe injury on his knee, and I actually a couple times went into the physical therapy clinic with him. And the two physical therapists that were kind of friends of the family took some extra time, explained to me why they were doing what they were doing and how they were doing it, what they expected. And the thing that really grabbed me was the instant gratification. They would, in 45 minutes or an hour, see him moving his knee significantly better than when he'd walked in. And it's one of the few things in medicine where you just almost immediately, every time someone comes in, you generally see some progress. And that appealed to my, the way that I like seeing those quick results. I was going to college, and I went to what's called an adaptive physical education class, where we helped the students that needed the adaptive therapy. So you worked under a physical therapist and would help people. And one of the patients, and I still get almost misty-eyed when I talk about her, she'd wanted to dance with her husband. That was the one thing she wanted, but she'd had some problems with her back and had a foot drop that prevented her from dancing. And after the third time I had worked with her, she came back in, and see, I'm getting misty-eyed now. She came back in, gave me a huge hug, and said, "I danced last night with my husband."
Mark, that's great. That's very gratifying, isn't it?
Oh, it's absolutely.
Mark, let's talk a little bit about other areas besides post-surgery physical therapy that you like to take care of patients with now. For example, sports, or maybe after a stroke, or perhaps as someone getting older notes that they're getting a little stiffer and less limber. Do you take care of patients who bring in those sorts of complaints to you?
We do see a lot of patients referred for that. A lot of times they'll see a general practitioner for their yearly exam or 6-month exam, and they'll notice that they're having more trouble just getting up out of the chair, getting in from the waiting room into the exam room and such. And a lot of the doctors are very keyed into trying to stop problems from becoming a big problem by getting it small. One of the things we like to, you know, kind of always let people know is that if you catch something fairly early on, usually it's going to go away fairly quickly. And the longer you grit your teeth and let it go, the worse it's going to be. So we do a lot of times we'll get patients sent in, and it'll just be for some balance retraining. So we'll see them 3 or maybe 6 times, teach them some balance exercises, teach them a little bit of strengthening, the quadriceps, the abdominals, just some things they need to be aware of. some real simple 5 or 6 step home exercise programs and get them going in that. And then we may see them again 6 months later just to check up on their program for a time or two. Stanford's done some fascinating studies, and some of the other universities also, on injury prevention by preventing falls. And I was looking at some information. They said that a patient over 65 years old, any person over 65 years old, has a 30-something% chance of falling this year. And we know that with fractured wrist, fractured hips, or just simply the loss of confidence from falling, even if you're not injured, can really take a person and make them be able to do a lot less than what they would be able to do normally. So if we can find someone that's at risk for that, give them some exercises and prevent it. And the numbers for prevention are very high. If we can get a person to do the exercises on a regular basis, the chance of them falling drops significantly down. So I'd much rather see someone 2 or 3 times, teach them how not to break their hip, rather than see them after they've fallen and broken their hip or their wrist, and now they're going to need, significant therapy at that point.
Well, Mark, that sounds like very wise thinking and a very wise way to approach some of these issues. Mark, you mentioned back pain. That ubiquitous complaint. I mean, I read something like 95% of adults in America will at one time or another complain of lower back pain. And of course, not all those people need an operation or could be even helped by an operation. Do you ever see people referred to your office with back pain?
We do quite a lot, and back pain is a fascinating subject. You can take 10 people that have the exact same MRI, you look at it on the MRI and the back looks exactly the same, and you'll get 10 different responses of how bad does your back hurt and when does it hurt. And that makes it challenging to treat, but there are some principles that most of us know. As we get older, our hamstrings get a little tighter, and our abdominals tend to get a little bit weaker. We do tend to lose balance a little bit more, and balance is a huge component of lower back pain, actually. Let's say that someone isn't balancing very well, and therefore every time they take a step their body sways back and forth a little bit more than it used to. That extra motion at the lower back tends to create problems at times, particularly if they get a little bit of stiff in the hamstrings to go along with it and the abdominals aren't holding as tight as they used to be. So you have a person coming in with lower back pain, and you immediately start working on some of the abdominals and their stretching. Those are things that they usually pretty much expect to have happen. But then you'll also work with them on, here's some balance exercises and such, and that takes a lot of explaining because, oftentimes that's not something they've heard of in anywhere else, actually. But a lot of times you'll take a short videotape and show them just how much they're swaying when they walk. And then if they get their abdominals a little tighter and they do a few of the things right and they can see on the video, hey, I'm not swaying nearly as much as I used to, that can be a really powerful tool also.
Mark, a very smart doctor that I know who's a specialist in pain and takes care of a lot of people and patients with back pain told me one time that if someone does regular stretching or something like an activity like yoga regularly, that their incidence of back pain will go way down compared to the population of people who don't stretch or don't do something like yoga. Do you find that to be true? Is it really a lot about flexibility?
A lot of it is about flexibility, but and that's a huge portion, but there is a lot that I think that they're going to find out over the next 5 or 10 years as they continue to study, why do some people with the same flexibility have back pain and some people don't. But we do find that someone that takes just as simple as a daily walk, if someone spends 20 minutes a day walking down by the beachfront or walking around the neighborhood, they're going to have a lot less incidence of low back pain than someone that doesn't. And that doesn't mean that they'll never have lower back pain, but we just find that it's generally something that won't bother them nearly as long or be nearly as significant if they do have an episode. And the chance of them getting the episode is much less. Yoga is obviously wonderful because you have to work on your balance and there's a lot of flexibility, particularly if it's geared towards your age group and they're not trying to push you too hard. And most of the yoga teachers that I've met are very good about that, realizing that you need to be a little bit careful as you get a little older. Those type of activities really do, I think, decrease the risk of lower back pain.
Mark, speaking of flexibility and balance, I saw a very interesting article in one of the local magazines recently featuring you and Dr. Michael Klassen, an orthopedic surgeon, and it seems like you guys take care of a lot of golfers and people who are very active in sports, whether it's even after an operation for their golfing or sports activity or just because they're athletic. Isn't that true?
That's true. I mean, you look at what it looked like outside today. It's absolutely beautiful out there. We live in a place that you can play golf or tennis or any sport you choose year-round. Because of that, we do see sometimes people that have gone a little too far or a little too much and end up, being injured The golfing is interesting because golfing is this motion, this huge rotary motion of the hips and the shoulders and such. And Dr. Klassen sees the results with the shoulders and the backs that have been torn up enough to where they're end up having to have surgery and then the rehab. We oftentimes will see them before that point to try to prevent it. The golfing is, I mean, it's just a fascinating subject. You can go on for literally hours and hours talking about the golf swing, what stretches are useful, what stretches aren't. One of the things that we really look at there with the golf swing, though, is that someone has really good flexibility through the trunk, but be able to maintain some abdominal core support, because as they rotate the upper body on the lower body, which is where you generate your power from, there's a lot that can go wrong if you don't have the correct set of motions. Your teaching pros, they're really, in the last 25 years, have a lot better understanding of human physiology and anatomy, and that's, we've seen some of the injuries that we used to see going down, but the main thing is that if the flexibility, as we were talking about earlier, if you keep your flexibility, if you walk a little bit, I think the golf cart's one of the biggest reasons we have some of the injuries that we do. If you look at the numbers of golfers in Scotland have much less injury than golfers in the United States. Well, in Scotland, you don't have the motorized carts almost at all. There's just basically walking. And I think if we saw more people walking more, taking the cartless, I think we'd see less injuries too.
Well, Mark, that's very interesting. I played a lot of sports in high school and college, and it seems like when I was in high school, the emphasis was on building strength. They encouraged weight training and resistance exercises. But by the time I got to college at the Naval Academy, they told us that the new science now recognizes that flexibility is almost or perhaps more important than strength. Have you seen that in the sports world? Do you agree with that, or do you think is it a combination of the strength and the flexibility?
I think it's a combination. The interesting thing is, if you look at the way that the Greeks worked out, I think they had a pretty good idea. They would take a large stone or rock, they would be reaching far above their shoulder, as far as they could stretch back, and then bringing it down to the floor, and then as far as they could the other side. There was a lot of flexibility combined with strength, and I think we need to see more and more of that as we go along, because just sitting on a machine or just doing some free weights and pumping out a lot of repetitions may make you very strong, but it doesn't make you flexible. And I think the Greeks had the right idea in that respect.
I see. Mark, I appreciate that very much. We've only got a couple more minutes to go, so before we close, I want to make sure that we give out your contact information. We're not done yet, but of course I want to make sure that we give out your contact information. Then I want to talk about Tricia a little bit before we exit to our next segment. So Mark, if someone has questions about physical therapy or their athletic activities, or they're going to have an operation and they'd like to come and see you beforehand, how can they make an appointment to see you? Do they need to go through their doctor, or can they come primarily to you?
No, we see people only on physician referral. So they would
that's
need
interesting. So you see patients only by physician referral?
That's correct. There is some work towards direct access in physical therapy here in California that may or may not pass. The one thing I do like about physician referral is a physician has x-rays, which I don't have access to, blood tests, which I don't have access to. So it's kind of a safety net for me to have them see their physician first. If their physician is agreeable and says, yes, I think physical therapy would be something that would be helpful for you, they can call directly at the clinic. Usually doesn't take more than a day or two to get an appointment. We're pretty open about that. But we do see only on physician referral.
Okay, so Mark, may I give out your contact information?
Oh, absolutely.
The clinic, now, is that 373-1209?
Yes, that's correct.
Okay, Mark Young, Pacific Physical Therapy, and you're right on Pacific Street in Monterey.
Yeah, we always say on Pacific Street, by the Pacific Ocean.
Okay, so once again, Mark Young, 373-1209. Now, we have about a minute left. Can you tell me something about Tricia? I understand you have a colleague, and she received her doctorate in physical therapy in 2004.
And the physical therapy field by 2020 will be all doctorate level. Back when I went 5 years ago, that was not the case. She's been working with me since 2004. She did an actual clinical residency with me, and we liked her so much that we made a job offer. Been very, very happy. Excellent physical therapist. She does a lot of Pilates, and she also does a lot of vestibular physical therapy, which is a very interesting specialty in the field, having to do with your balance and the crystals in your ear and what happens when they become lodged in the wrong space.
So physical therapists now can actually help people who are having balance problems, not strength-only problems or flexibility-only problems or post-surgical problems. You guys do so much.
Yeah, that's quite a lot, yes.
Well, Mark Young, physical therapist. That's Pacific Physical Therapy here in Monterey, 373-1209. Mark, so great that you would come on the program. Thanks so much for being here. I hope you come on again.
You're welcome. Thank you very much.
Thanks for being here. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and this is Your Health radio and television program. We're going to take a very brief pause for a very good cause. We're coming right back. Thanks so much for being here.